How does MRI information help in diagnosing migraines? When it comes to diagnosing migraines, magnetic resonance imaging, or MRI, plays a vital role. It primarily helps by excluding other potential causes of headache symptoms. While migraines do not have a specific signature on MRI scans, these images provide detailed views of the brain's structure. This is crucial because other serious conditions can mimic migraine symptoms. One of the key ways MRI helps is by excluding secondary causes of headaches. Doctors use MRI to check for serious issues like brain tumors, aneurysms, strokes, or infections. Since migraine symptoms can overlap with those of other neurological diseases, a normal MRI can support the diagnosis of primary headache disorders like migraines. Additionally, MRI can detect subtle brain changes associated with migraines. Some studies show that patients may have small white matter hyperintensities or changes in cortical thickness. While these findings are not specific to migraines, they can offer insights into how recurrent migraines might impact the brain. However, it is important to note that these changes can also appear in other conditions. Advanced MRI techniques, like functional MRI and diffusion tensor imaging, are used in research to study brain activity during migraine attacks and in between them. These studies help scientists understand migraine mechanisms, such as cortical hyperexcitability and altered pain processing. However, these advanced techniques are not typically used for routine clinical diagnosis. MRI also guides clinical decision-making. If a patient has atypical migraine symptoms, worsening headaches, or neurological deficits, MRI helps doctors decide on further investigations or treatments. It can also identify complications related to migraines or medication overuse. Furthermore, MRI can differentiate migraines from other functional or neurological disorders. By providing objective evidence of brain structure, it helps rule out abnormalities that could explain the headaches. In summary, while MRI does not directly diagnose migraines, it is a valuable tool in evaluating headaches. It helps exclude other causes and sometimes reveals nonspecific brain changes associated with migraines. Patients with typical migraine symptoms may not always need an MRI, but it is essential when symptoms are unusual or concerning. Always consult healthcare professionals for personalized advice on when MRI or other imaging is appropriate and how to interpret the results within the broader context of care.